Hey doctors, my name is Dr. Angad Roy and I'm here to tell you the must-know things which you need to know in this last 1 week before giving your Fmge exam. I'll give a short introduction about me. My name is Dr. Angad Roy and had scored an All India rank 9 in the June 23 Fmge exam. The list of things which I've given, I have noted it down and I'll talk to you about it in a very short way. Number one thing is I want you to follow your plan. In YouTube now there are many people who are being telling you follow this, do this, do this. No, nothing. You have trusted your plan for the last 6 months or whatever period you are studying for and trust it right now. The marathon is done. These last 5 days sprint is again going to work for you. Second thing I want you to do is try to avoid stress for the last day. 12th January is the examination. I know some of you have planned, okay, I might study the volatile subjects on the 11th. I might study the breast cancer staging or multiple staging on the 11th. Please do not do that. Try to, whatever plan you have of 11th, try to convert it back to 10th. So that the problem is on the 11th there can be multiple problems, like maybe some of your documents are missing. You will find that then that stress will be there. Maybe you have to travel and your center is a bit far. So these all things will be there. So then what I would recommend you is just try to, whatever subject or whatever topics you have, try to get it done on 10th. Even though if you have a chance to study it on 11th, good to go. But make sure that on 11th, try to minimize as much as things you can. Third thing is, whatever documents, whatever, like, your passport, your admit card, whatever you need to have, make sure you have it right now. Don't keep it till the end, otherwise you'll worry. Now, why am I emphasizing on stress so much is that no matter how much you have studied in this last couple of months, it will all go in vain if you get stressed during the examination. Okay. Third thing what I want you guys to know is that if you guys are exhausted during your studies, first of all, in your plan, trust your notes. Okay, just revise your notes and do PYQs. You don't need to do any other questions which people are doing. Do this falana Q bank, do this Q bank. No, nothing. Just do your PYQs. Okay, and along with that, images is utmost important. If few of you are there who are not revising the images regularly, now is the time that you have to start revising the images. So make sure you revise PYQs, do the images and your revision. Now, for example, right now, there are few days left and you guys are very stressed. Maybe you're studying hours and hours in a day and there is a time where you're getting burned out and you still want to study. Ideally, after a burnout, you need to take a break, but you know that there are just 4 or 5 days and you just want to push and you want to try your best. In YouTube, they have this LLR, Prep Ladders LLR, you must have seen. It's completely free. During your time where you're not able to revise properly or when you're so fed up of revising any subject, you can use this LLR as a source of revision. Whatever any doctor is going to ask, just try to answer that beforehand, before she's going to say. So it will be it's going to be a technique to recall. Okay. Second thing is that MIST, right? MIST has 25 important must-know questions. Please make sure that at least you go through those questions, because during my time of examination in surgery, 2 questions would directly repeat from there. Means they have a probability, I don't know how, but then yes, it is the important topics which they do cover. So I'm not telling you to watch the entire video because it's an hour and a half type video. At least they'll give you a PDF. I guess it's available in their Telegram channel. So make sure that you at least understand what was the question, why those options were asked, and what was the answer. Along with that, I want you guys to focus with your routine. If you are someone who's studying at night, who you're saying, yes, doctor, my preparation, my studies is best at night and I can only study at night, please, you have to change that. As you all know, the examination will be around 8 and you have to wake up at least 2-3 hours prior. So, and during that time, if you're having any type of jet lag, you can say because of your study routine, it is going to reduce your concentration and thereby affect your attention. So make sure at least now you have to start changing your routine. Start meditating, very important. I know some people feel like, what is meditation and all? I'm not asking you to do the proper, proper procedural way. On YouTube, you can check a 5 minutes YouTube, okay? 5 minutes meditating video. It is there for free. Just close your eyes wherever you are, maybe in your study room or your bed or somewhere. Just close your eyes and try to follow it with deep breaths. Okay, try to follow it deep breaths. 5 minutes video. I'll put it in the description. Just do that at least for the next 5 to 6 days. Okay. During whenever you're going to solve the exam, in the exam, whenever you're going to solve the question, this is the way which I want you guys to solve the question. For example, a question is there, very easy question. You're like, oh, this I answer, I know the answer very nicely. Answer, you'll mark it and you'll go. No, don't do that. Read the question, mark the answer. Before going to the next question, I want you to read the question again, like you're reading it for the first time. There is a reason for this. One, because at times we forget these 4 volatile things: none of the above, all of the above, except, such things are there which you tend to, because of the hyper, if I will see like, okay, papillary thyroid cancer will be there, okay, you know that orphan ani, so then you get very hyper because this is such an obvious thing. But at times we can miss these things, except none of the above. So this will get eliminated by your second read. At times, whenever you're having a long question or you're taking some time in the question, time limit gets your time gets constrained. And if you do two times, if you revise and you do the question 2 times already, that time this thing will not be worried later on, because you have already cross-checked the question. Okay, whenever you have long questions, what I want to do is, if there is a long question, read the last line first, because when you read the last line first, you will be able to understand what the question is trying to answer, and then you can direct your mind to read that question that way. If you're going to have a new question, please do not panic, because there might be a situation, maybe in first paper, probably PSM, that there are 4 or 5 questions in a row where you're not able to answer, and that can induce panic. But what I wanted to do is, if there is a completely new question where you have no idea about it, read the questions. Out of those 4 options, at least 2 to 3 will be there where you must have read somewhere or the other, definitely. So what I want you to do is try to focus. If you have a notebook, for example, like I gave you example of papillary thyroid carcinoma, wherever in your book, maybe it is in the middle, up, right, lower, just try to remember it in that topic. And if in that topic that option does not relate to the question, eliminate. So that's how you solve new questions. Try to eliminate it with the options. 3 options will be familiar. You have never heard the topic which they're asking, so the answer would be the one which you don't know. So new questions, very easy. Last thing is, please don't again and again change your answers. The first answer which you had from your heart, from your gut, that was the right answer. Most of the time it happens. Out of 10, at least 8 times that answer is going to be right. So please do not change your answer again. So what did I say? I would like to summarize. Meditate. 5 minutes video, I'll keep it in the description. It's free on YouTube, you can do that. Make sure you don't keep any stress on the last day of the examination. Whatever you have planned, that is very good. Follow that and stick to it. Images should be done. Please do not ignore them. If you are getting burned out with the amount of revision, any sort of revision videos you can do, I would suggest LLR, because LLR, like, especially Dr. Preeti Sharma ma'am, she has microbiology and pathology. They are literally the best. Free on YouTube, just check them out. They are very good. Missed 25 questions, most of the subjects, at least go through all the subject ka PDF. In that PDF, see what question they asked, why that answer is there, and what are the 3 options. Like that, you will have another boost. And the last thing what I want to tell everyone is, if there is someone who has not prepared for anything and who still wants to attempt just to see for the examination, I had a mega revision session for around 5 days, 4 to 5 days, which I've uploaded on YouTube. Again, I don't want everyone to do it. If you already have a lot to revise, please, this is not just stop the video and go and start studying again. This is for someone who just wants a quick revision, because that videos which I have uploaded have around 1000 plus PYQ topics discussed. And out of all of them, I will not guarantee you that something can come from there. Maybe everything can come, maybe nothing can come. But one thing for sure you can get is confidence. If right now, while revising your notes or anything, you are lacking confidence, watch such videos, watch some revision videos, watch some LLR videos, or some some videos which will try to push you and think against your passive study. Okay, any issue you have with respect to mental stress, with respect to any doubts or something, text me at jabstudiesmetfun on Telegram or Instagram, wherever you want. 5 days, I'm here for you. All the best for the exam, and I am telling you, you will pass. I know that you will pass. Now the only one you have to convince is you yourself. All the best. See you on this side. Take care.